For people who rely on medications for treating health problems, the cost is only part of the problem. Sometimes the greater challenge is making sure the medications are taken properly. The problem is being addressed in a report just issued by the partnership Prescriptions for a Healthy America. Joining us is its director, who's also director of the Council for Affordable Health Coverage, Sloane Salzburg, and also with us is a registered nurse at Boston Medical Center's Cardiology Department, Deborah Whalen. Thank you both very much for being with us.
Thank you.
I want to start with Sloane. This is a national report we're talking about here.
Yes.
And basically, how big a problem is this, people not taking the medications the right way?
So it's huge. It's been estimated from $100 to $300 billion a year from people not taking their prescriptions properly. And that's touching, everyone in the United States of America, whether or not you decide to take your pill, which is managing your chronic medication, and whether or not you take that pill and it helps to manage your disease. Or
well, Deborah, talk about how complicated it can be for someone. You work in cardiology. If someone has heart problems, they might first of all have multiple meds they got to take at different times of the day and night.
Correct. It's very complicated. You come into the hospital, maybe not on any medications before, never even having taken or picked up prescriptions, and now you're leaving the hospital with sometimes 6 to 8 prescriptions, new medications. So from the very beginning, healthcare providers really need to focus on what are going to be your barriers to taking medications as the patient. How are you going to get your medications? What are your co-pays going to be like? How are you going to understand your medications so that you take them in the right way? And what do we do to help you do that? How do we simplify medications? 3 or 4 times a day is never going to work for patients. They need to, as much as we can, to try to bring them to single times a day, 1 pill a day. And many other drug manufacturers have really worked with us, so we now have drugs that we can give once a day. And then I need to help you know how to pick them up, how to refill them, how to take them, and why you should not stop taking them. So that's a really important piece. It's very complicated.
Sloane, you mentioned this is an expensive problem. What's it like for people's health?
So imagine this, you have a heart condition and you don't take your Lipitor, for example. You have a heart attack. So taking your medication really helps to improve the outcomes. And not only that, it also saves the whole healthcare system money, because the cost of 1 pill versus the cost of a heart attack is very significant. So at the national level, Prescriptions for a Healthy America we have over 50 partners, from the pharmacists, from the medical providers, from the patient groups to the pharmaceuticals companies, really kind of getting around how do we help improve outcomes, decrease costs in the health system.
Coming back to Deborah, what do you think causes people to fall off the track, as it were? What do you think's going on?
I think a lot of times they really just don't understand the importance. So I give you discharge medications, you're going home, and I haven't really explained it to you in the context of your health. If I say to you, I use an example, a water pill, and I tell you that take this water pill, but I don't say to you, this water pill really will be what will keep you out of the hospital from having further heart failure. And I don't tell you the magic number, and I don't tell you to weigh yourself. I need to say to you, weigh yourself every morning. The magic number to keep yourself out of the hospital that tells you you don't have too much water on board is this weight. And if your weight goes up 3 pounds, then you need to call this number, this provider. It's the level of detail. It's the importance is giving the patient the numbers, the information, so they become true partners with us, and also doing it in their language. And that's a really important thing. At Boston Medical Center, you can only imagine the number of languages our patients speak. So I need to do that with an interpreter. I need to do it. I need to have the patient tell me back what I've told them. And short hospitalizations, 4 and 5 days, it's really hard for patients to really get and understand what they need to do. I need to be the one to take those barriers away from them.
Sloane, there are some people, whether it's because of their health or their age, they're not able to negotiate that kind of exchange with the provider, much as they might be inclined to, and maybe they're not living with relatives who can do it for them. So what happens to people like that?
So education is a real big key. I used to work in an ER down in Florida. patients are generally scared when they go in the physician offices. They don't know what type of questions they ask. They sit there and just nod their heads, and then they leave, and they don't know what to do. So what Prescriptions for Healthy America is doing is we're kind of taking it at the national level. What can we do as policy makers to help trickle down to the patients and help incentivize physicians and pharmacists and the whole entire healthcare continuum to help improve not only the education but also the act of adhering to your medication.
Does that mean maybe people following up with people, just
Exactly.
checking back the next day? How's it going?
Exactly. And medication synchronization is one big avenue that we're really looking into. And that's the idea of syncing your patient's medication to 1 day a month. And so if you're on more than one medication, you might be going in there 3 or 4 times a month. So you sync it up to 1 day a month. The pharmacist then calls the patient a week prior to that sync date and kind of goes through a medication reconciliation. Say, you know, Mr. Smith, are you still on this and this? If you're not, let's call your physician and see if you should be taking it or if you shouldn't. And so that's a really popular policy that we're working on, and it's really exciting because the patients like it because of the convenience factor. The physicians like it. Again, they're only getting called once a month for refill requests. The pharmacists like it. They can plan when the patients are coming in. So it's really good.
Deborah, Whalen, at Boston Medical Center, you're connected to the Neighborhood Health Plan, and there's a whole new set of standards in place about this very issue.
There is, and we try to really work with our neighborhood health plan and all our insurer partners. One of the things we're doing is really trying to make sure our patients, when you talk about the follow-up, that actually all patients leaving cardiology will identify your level of risk, how much, and the level of complexity of your medications and your illness. And based on that, we'll either bring you back for a 7-day follow-up, 14-day follow-up. We know most readmissions reoccur within 15 days. And in addition to that, we'll also give you a call by our clinical pharmacist to give you a call within 2 days of leaving the medical center to make sure you've got your medications, that you don't have questions, and most importantly, that you're not continuing to take medications at home that you had there that are no longer on your medication list.
All right, thank you both very much, Deborah Whalen and Sloane Salzburg. We'll have more news in just a moment.